Good afternoon, everyone. On behalf of HR Downloads, I'd like to thank you for joining us today on our presentation of supporting mental health in the workplace during COVID-19. We will cover key considerations all employers should be thinking about when addressing employees' mental health concerns in the workplace. Throughout this webinar, we will provide you with value-added tips and solutions for identifying, addressing, and helping manage mental health. My name is Kim Morris. I'm a Senior HR Advisor here at the HR Downloads team, and we'll be taking you through today's topic. Our focus today is to provide you with tips and suggestions to ensure your managers are confident in identifying and managing mental health in your organization. We will cover why workplace mental health matters, how to think about mental health as a leader, mental health in the time of COVID-19, and accommodation and mental health. At HR Downloads, we believe that having an actionable plan to implement new concepts is just as important as the knowledge itself. To help you understand and manage your employees' mental health and well-being, we are offering a free checklist to all registrants that will help you build on the tips that we'll be talking about in today's webinar. You'll receive this within a few business days to the email that you used to register for this webinar. Let's get started. The Mental Health Commission of Canada reports that in any given year, 1 in 5 Canadians will experience mental health or a mental health related problem. And in general, in times pre-pandemic, it's estimated that more than 25% of Canadian employees perceive that their work-related stress to be high. In any given week, approximately 500,000 Canadians miss work due to mental health problems or illnesses. Mental illness results in an economic loss of nearly $51 billion a year, out of which $20 billion represents direct losses sustained by Canadian companies. Research also reveals that mental health problems and illnesses account for nearly 30% of short and long-term disability claims in Canada. Mental health in the time of COVID-19. Well, everyone can be directly or indirectly affected by mental health issues at some point, whether it's ourselves, family, or the people we work with. Mental health initiatives have been a major focus for organizations for quite some time. But now, with the added impacts from the COVID-19 pandemic, employers are likely to encounter new mental health challenges in the workplace as we continue to adapt through these uncertain times. Mental health concerns and issues have increased over the last few months as a result of the crisis, and it is expected there will continue to be a long-term rise in the number and severity of mental health problems. The impact can already be seen that affect mental health in many different ways in the form of stress and anxiety as a response to the disrupted routines, uncertainty of circumstances and what will happen next, fear of contracting the virus, coping with isolation, or financial impacts due to the temporary or permanent loss of employment. Other common responses include fear and panic, grief, depression, nervousness or constant feeling on edge, trouble relaxing, or even irritable or becoming easily annoyed. Some COVID-related mental health statistics. In a recent survey about the impacts of COVID-19 on Canadians from Stats Canada, it was reported that 24% of Canadians that participated are experiencing poor or only fair mental health. 2018 survey data had found that only 8% of Canadians had experienced the same. Over half of these surveys participants said that their mental health had suffered and actually worsened since physical distancing measures had begun. 88% of the participants had experienced anxiety in some form around the time of the survey, and for those who felt their mental health had worsened from physical distancing, 41% said that their anxiety symptoms were moderate to severe. Financial and economic hardships, such as financial burden, have also led to a significant increase in anxiety and stress. As a result of the anxiety and depression, the Canadian Association of Mental Health reported that nearly 25% of Canadians have engaged in or have turned to substance abuse, such as binge drinking as a coping mechanism, and that a percentage is higher for those worried about their impact to their financial situation. In normal circumstances, the workplace for some was a distraction from life issues, a place of refuge where going through difficult times, and a place where employees felt support from the company when dealing with personal or family issues. Because most of us have spent over half of our life and time at work, the workplace has played a significant role in our ability to manage and support our mental health. The workplace can either have a psychological well-being or it can hinder it and actually be the source of stress and mental health issues, or cause existing issues unrelated to work to worsen. Many employees' mental health may have suffered while being away from the workplace or dealing with the stresses of working during the pandemic. So it's important to make sure the work environment is just as safe and supportive as it was before COVID-19. According to the Mental Health Commission of Canada, mental health and our state of well-being is our state of well-being while we cope with the normal stresses of life. We can usually work productively and fruitfully, realize our own potential, and be able to make a contribution to our community. In a mentally healthy workplace, employers support an employee's involvement in work and interpersonal growth and development. Employees then feel safe, respected, and valued, morale and satisfaction increase, and the workplace benefits from increased productivity, retention, and employee engagement. Engaged employees are more likely to believe their work is important, enjoy and are proud of what they do, and are willing to put in an extra effort to commit to the success of the company. On the other hand, when mental health is not supported in the workplace and psychological needs and support go unmet, it can actually worsen mental health, leading to feelings of failure or unbelonging, and employees not feeling safe while on the job or while returning to work. So recognizing and addressing mental health issues are important. Poor mental health impacts the employee's ability to thrive and negatively impacts their ability to do their job, possibly resulting in absenteeism. Employees are more likely to take days off for their mental health reasons, general stress, or stress caused by the job. High turnover. Employees are more likely to leave a job due to stress. Lowered work performance and the deterioration of an individual's physical and mental condition, burnout, or even a nervous or stress-related breakdown. Increased illnesses and injuries, and certainly disability claims. We would pose that mental health and physical health are related. Stress related to work is a harmful combination of physical and emotional reactions where there is a conflict between job demands and control over meeting those demands. Sometimes stress is considered positive when a task is challenging but still attainable. A high job demand where an employee has little to no control over meeting those demands or is unable to meet those demands will lead to an increase in stress on the employee. Canadian Mental Health Association identifies stress as a reaction to a situation rather than the situation itself. Well, in a pandemic, because the situation is constantly changing and evolving, there's so much uncertainty, and there may be little to no control over our situation. Our reaction to what is out of our control is amplified, and thus the amount of stress drastically increases. It's important to understand this correlation between mental health and physical health. Mental health issues such as stress and anxiety can have severe negative effects over one's physical health. When stress is more than an individual can handle, both mental and physical health are impacted. Physical impact of stresses may include headaches, muscle tension or pain, certainly increased blood pressure and heart rate or chest pains, high blood sugar, increased cholesterol, heart disease, obesity, a weakened immune system and increase in illnesses, fatigue and insomnia, and stomach and digestive issues and ulcers. Emotional, mental impacts of stress include restlessness, irritability, mood swings, anger, hypersensitivity to situations, and the ability to focus or think clearly. So as we mentioned with stress, mental and physical health are related, and poor mental health will almost always lead to poor physical health and vice versa. While depression, stress, and anxiety are common in the workforce, those with chronic health conditions or illnesses such as heart disease, diabetes, long-term or permanent pain or disability, They're significantly more likely to experience depressive symptoms or a depressive episode, anxiety disorders, suicidal thoughts, or behaviors than those without chronic health conditions. When an employee is under a substantial amount of stress, their brain perceives it as a threat and activates the brain the same way they would react if there was a physical threat to their safety or life. When feeling threatened, the ability to do a job and perform work is likely to be negatively affected on the employees. So they can become momentarily distracted, which can be dangerous in some lines of work. They may withdraw or isolate from others. They are more likely to have outbursts or snap at their coworkers or managers. They neglect their job or work-related responsibilities. They may make errors in judgment, have difficulty with coordination or other physical activities. And there's an increase in the risk of strains and injuries due to putting their body under additional physical stress. So, workplaces, we must address and treat mental and physical health the same way. While it's crucial to manage mental health issues before they lead to physical illness, individuals with physical disabilities and illnesses often experience or develop mental health problems. One way to understand how the brain and the body react positively to rewarding situations or negatively to stress is to have an understanding of the SCARF model. The SCARF model, it's a framework for understanding the 5 primary social dimensions. They are status, certainty, autonomy, relatedness, and fairness, and how our brain responds or perceives to those rewards or threats, either by retreating from threats or moving towards anything that is rewarding. Everyone has basic human needs that need to be satisfied in order to lead a mentally, physically, and psychologically healthy life. In the workplace, these needs need to be met when the employees receive support, direction, and resources from their coworkers and their employer. So the SCARF model can be used to narrow down specific factors and the basic needs of employees that can be perceived as a threat, which ultimately could contribute to the increase in workplace stressors, or are considered rewarding and contribute to a positive, harmonious work environment for the employee. When these needs go unmet or are obstructed, they can become risk factors for psychological distress and health problems, including mild to severe depression, anxiety disorders, and learning disorders. To dig into the SCARF model some more, the first factor is status. This comes from the form of self-esteem, self-worth, and our perceived related importance to others. Employees are more likely to feel rewarded, recognized, and respected when they have that sense of belonging and receive acknowledgement and/or reward for work. Could be recognizing good performance and celebrating milestones. However, where there is no recognition or feedback, employees can feel torn down and will retreat from the threat. Certainty is the next factor of the SCARF model. This addresses our concerns about what's next and the ability to protect the future. When we experience certainty, our brain can sense patterns, predicts next step, and we're able to work efficiently. But when there is uncertainty and we're unable to predict the next step, our brain triggers a threat response, leading to mild stress, all the way up to panic. In the case of this pandemic, it's an unprecedented time of uncertainty because the situation information is shifting by the day, and we don't know and certainly can't predict what's next. In the SCARF model, autonomy, which is our sense of how much control we have over a situation or our environment, directly correlates with stress. So in a workplace, micromanagement and excessive workload could be perceived as a threat, where employees feel like they have little or no involvement in decision making and have any input or influence over the job or how the work is done. In some workplaces, it's not always possible to give employees complete autonomy. However, employees can feel rewarded when they are included in discussions about how the work is done and how decisions are made, and when assigned tasks can be accomplished successfully in the time frame that's available. So our next step is relatedness. Excuse me. This can be measured by our sense of safety with others. This is rewarded in the sense of trust when the employee's psychological safety and social support is ensured by the amount of social and emotional integration and trust among coworkers, supervisors, including the assistance from others. Organizational cultures can enhance that psychological safety of workplaces when it's characterized by trust, honesty, respect, civility, and fairness, but can become a threatening environment when we lose trust in those we work with. So our final factor is that fairness, our perception of fair exchanges between people. When an environment is perceived, they will also increase their trust in those they work with. Fairness can be demonstrated by treating everyone with equal respect, ensuring processes are followed for and rewarded for those deserving extra, such as giving someone a promotion, perhaps. Fairness is relative, however, and an employee is more likely to find a situation unfair where there's a lack of expectations or certainly clear rules. Then feelings of unfairness can amplify stress and increase the negative effects on health. So let's look at our workplace factors that impact mental health. Certainly there's a need for employees to feel supported in the workplace, whether they are continuing to work or will be returning back to work. There is a national standards that recognize a number of factors that can positively or negatively impact mental health. So it's up to employers to look at each of these internal factors and determine how they can contribute to supporting their employees' mental health. We have organizational culture. So this enhances their psychological safety at the workplace. This would be characterized by trust, honesty, respect, civility, and fairness. Psychological and social supports, well, the amount of social and emotional integration and trust between the coworkers, including assistance from others. So we're certainly, again, coming back around seeing how the SCARF model works into your workplace. Clear leadership and expectations. So this is leadership that's effective, provides sufficient support, explains how their work contributes to the organization, and reasons and expectations where there are changes. Civility and respect, well, workers are respectful and considerate of others. Psychological demands. So that would look at determining if the activity of a job might be hazardous to the employee's health and well-being and should be assessed and documented the same as physical demands are. Growth and development, where workers get support and encouragement to develop their interpersonal, emotional, and job skills. Recognition and reward would be appropriate acknowledgement for work such as celebrations, recognizing good performance, and milestones. Involvement and influence would be where workers feel they are included in discussions about how their work is done and how decisions are made. Certainly workload management has assigned tasks that can be accomplished successfully in the time frame available, and this, we would say, is the biggest workplace stressor. Engagement, well, we want our workers to enjoy and be connected to their work and feel motivated to do a good job. Balance, a sense of harmony between personal life, family, and work. Psychological protection, their safety is ensured. They can ask questions, they can seek feedback, bring up issues without fear of consequences to themselves or to their job. And then the protection of physical safety. So their psychological and physical safety are protected from hazards related to that physical environment. So it's important for employers to address the structural control within their organization before putting the responsibility of recognizing and taking care of mental health issues entirely on the employees to address it themselves. As an employer, you're more responsible over your employees' mental health than you might think. Organizations must look at how they can proactively recognize or prevent mental health issues that may or may not be entirely workplace related. The key here is to identify what's causing stress to the employees and where those stressors are rooted from. So if we're looking at root cause, we've got a number of job-related stressors that should be reviewed. They could be around task design. Is the workload, is it too much? Is it too little? The pace, the variety. Are they given enough time to complete their tasks? We mentioned before, do they have autonomy around that task design? Also, we could look at work hours, shifts scheduled, too much, too little, lack of appreciation from others, isolation, so when they're working remotely and alone, or just emotional isolation. Under role, we might have that there's conflicting roles or job demands, such as too much responsibilities, multiple positions, or roles that might be filled by only one person. Certainly ambiguity, uncertain or unclear job expectations. Under development, the lack of promotion or being promoted into an unfit role, or fear of the job security, or even if there's no opportunities for growth or advancement and there's no engagement. Around interpersonal relationships, we might look at certainly between the leaders and coworkers, recognizing conflicts or where they're not getting support or where their supervisors conflicts. They might feel threatened in the workplace. Is it discrimination? Is that they don't have a safe person to report unacceptable behavior to? Our organizational environment would be the level or participation in decision making, communication through the chain of command, lack of recognition or feedback, no place to voice a concern. Certainly the perceived fairness, and again, back to the SCARF model. Then we want work-life balance. Well, personal and life work-related conflicts, family exposure to work-related hazards. This is another pandemic-related concern, certainly, and many employees who are working from home or with the public may bring fear of bringing the virus home with them. And then our working conditions. Is it unpleasant or stressful work conditions? Do they feel it's an unsafe work environment? So with those root causes, we want to look at early identification and treatment. So they're important to prevent those workplace factors that are within the employer's control from harming or having a continuous negative impact on the mental wellness. So similarly to workplace risk assessment for factors around physical safety, hazard models can also be used to identify, treat, and prevent mental health issues. The goal here is to remove or prevent the hazard before the incident occurs. So employers should assess their workplace for physical and psychological hazards, then develop a plan to address and mitigate those hazards and risks. Much like you mop up a floor and put a wet floor sign, we look at the same risk assessment. So beginning with an organizational audit, we assess the existing practices in place and then promote psychological health and safety. Listing existing policies, procedures, and programs then can help you understand what's working well and can identify gaps and opportunities for improvement. A mental health assessment model, well, as we do with physical aspects, companies should develop and maintain documented risk mitigation. So you identify and eliminate. You assess and control. Implement, prevent those protection measures, and then reassess. And creating a workplace culture that promotes that psychological health and safety. So there may already be a risk assessment procedure in place that identifies your physical hazards, and this would follow the same steps, but the factors are to assess the mental health, and they'll vary and include psychological support, culture, clear leadership, respect, recognition, workload, the same factors we've referred to. So if we consider a model similar to the hierarchy of controls for personal protective equipment, personal protective equipment, or PPE, should always be used as the last line of defense and protection. And similar to protecting mental health, there are many steps that we can take to minimize or prevent mental health related issues before putting a Band-Aid solution on it and calling it a day. The hierarchy controls outlines to follow strategy to single out hazards before work begins and the steps taken from the top down. Eliminate, remove the hazards, find out what's the highest factor of stress and remove it. Substitution. If it can't be eliminated, consider replacing the stressor with something that has a similar outcome for the output of work. Engineering controls. So this would be removing people from the hazard rather than removing the hazard from the workplace. If returning to or remaining at work is a major source of stress, consider allowing them to work from home. It may end up having to be a leave of absence. Administrative controls, so changing the way they work, so changing up work duties, due dates, spreading out assignments. And there we are at the PPE, the last and final step, only after all other options have been attempted or reviewed. Now, in the case of a mental health challenge, this step could be considered giving the employee the contact information for an employee assistance plan, but not just leaving them on their own with no further advice or support. So a supportive workplace understands the importance of mental health. They should offer services, benefits, maybe assistance programs, in addition to having the control measures in place to reduce or prevent the issues before they happen. There are a number of solutions to support workplaces. The national standards of Canada for psychological health and safety in the workplace promotes this psychological health and preventing due to workplace factors. So it's a voluntary set of tools. They actually establish and maintain a psychological health and safety system. This can be complex, but it also can have great rewards. It looks around the commitment, the planning of it, so you need to identify and prioritize those hazards, and then looking at legal requirements, looking at system gaps and opportunities for improvement. Then you implement it, and then you evaluate it, do corrective actions, and probably go back to evaluate again. And then ongoing consistent management reviews. So again, just like physical health and safety, consult with their health and safety representatives or a committee with developing programs that address your mental health in the workplace. From a mental health first aid, we would suggest that leaders must go above and beyond what's considered a Band-Aid solution. Sometimes there is an immediate solution or fix, and you have an emerging health or an ongoing situation. It could be unrelated to work. In such a case, similar to how you provide first aid to someone who has been injured, you can offer mental health first aid until the appropriate treatment is found or a situation is resolved. So the idea would be recognizing and understanding the signs and the symptoms early on, positively promoting and advocating for their successful recovery. Frequent communication, even just checking in, could make a world of difference. Then we might look at, do you need to accommodate employees who may need job modifications or even time off? All through this, making them feel supported and reducing the stigma. We talked about there are tools. It could be employee assistance program, could be community services, outreach programs, reviewing their employment benefits and finding ways to improve on those offerings, and then certainly helping employees to have access to information. Let's talk about that reducing stigma. In the workplace, stigma associated with mental health has been reduced due to recognizing it's important, perhaps, and it is becoming more prevalent in the news and media. However, there's still a lingering stigma in the workplace, in society. Stigma around mental health happens when others don't understand it, they lack knowledge, they have no experience with it themselves. So now we have stereotypes and negative perceptions. Individuals with a stigma surrounding mental health can question the legitimacy that an employee is really struggling, or they might believe that someone's using it as an excuse. Oftentimes, employees, they won't come forward and they don't discuss their challenges out of fear of judgment or discrimination. They can feel that their employees are not supportive, or they might not feel they're understanding, and they won't be taken as seriously as, say, accommodating a physical health-related concern. So employees who are experiencing mental health issues as a result of COVID-19 may fear stigma from others who seem to be able to adapt during this changing circumstances, or those that are able to return to work easily without fear or stress. So we have to talk about adjusting to returning to work, or this new normal that none of us know what that means. So the pandemic obviously new to everyone. We're learning as the things evolve. In the case of COVID, the leadership has encountered challenges and new situations, as we have here at HR Downloads, that we haven't had to deal with before. Much of the concern related to COVID has revolved around protecting employees' health and safety in the workplace or returning to work. So, and we've got plenty that to look at new practices, preventing the contracting or spreading of the virus, barriers, distance measures. So while many employees have spent the last few months working from home, or may even have been laid off completely, now their workplace has been deemed non-essential, and they were shut down completely. Many employees have spent the last few months working from home and may have been laid off. Now they've got an adjustment period where they've had to adapt their work environment, and also maybe a period of going through various emotional stages: stress, shock, grief, fear. Now we have to adjust to a new pace when we get back to things, getting back on track, performing their new normal duties, or getting tasks done on time. concentrating on focusing on their work. They may have to adjust to new working hours, meeting new targets, or even trying to meet those pre-pandemic expectations. They're feeling comfortable with their interactions with coworkers. Maybe they have trouble of not being able to socialize like they were pre-pandemic, and then adjusting to modified workspaces. There may be barriers, distancing in the workplace, limited access to break areas, and all through this, managing their emotions while at work. So if we come back around to stress related to health and safety, they're likely to have legitimate concerns, anxieties, or fear over their health and safety when they come back to work. This we might even consider a type of COVID phobia. They could be fearful of catching the virus while working, whether from coworkers or maybe interactions with clients or the public. They could already have a medical condition that they're worried about, and they may be caring for family members or another person that's high risk. Those in the public may be more stressed out. This can make it difficult and add additional stressors for them to return to their work safely or even want to return to work. So now, just because an employee is working at home or has been off work doesn't mean that they can't experience burnout. Someone working from home is still just as likely to experience as someone who was in the workplace. They may actually have had more difficulty managing because they've not been able to separate work from home when restricted to one living and one workspace. Now, employees returning to work might be burnout because they're putting a different type of energy into these full work days. They might have to put their game face on and adjust their behaviors just to fit in with the workplace while reintegrating or working with the public. Employees may be dealing with grief or loss certainly related to COVID-19. This could be a family member, friend, or someone they know in general. Then experience a time of isolation and social distancing, not being able to mourn with family members or support someone else. Long periods of social distancing and isolation can and have had an effect on mental health. So while virtual meetings and parties have been popular, there's no replacement. So, and they may also have been struggling with the overall impact of how the pandemic itself has taken a huge toll on lives, jobs, the economy, and generally affected every aspect of our lives. It shows compassion to have a concern and feel what the others are going through. However, sometimes taking on what others are experiencing and going through that can be emotionally and mentally exhausting. So how can you help? So the number one responsibility is you are not a counselor, but you may have a new role in helping their employees adjust to what this new normal will be. Some employees might be nervous coming back or asking for assistance. Let's have an open door policy. Let's have that communication. So not force the employee to explain what their specific issue is, but just recognize the change, early identification, mental health first aid, help them with their recovering and prevention of future illnesses. So workplace should already have these processes in place to intervene at the first sign that someone appears to be distressed at work. Work still needs to get done, and managers must recognize it'll still take some time for the employees to adjust, try and show some compassion during this time. You're not required to bend the rules per se, but maybe make adjustments and ensure that the return to operations is less stressful, and they'll still be able to perform their job as best they can based on this situation. So employers and employees have a responsibility when it comes to maintaining and improving mental health. Employees should be encouraged, speak out, reach out to their manager for support. They need to understand that their employer is concerned about them, but be aware of and know the supports and resources available, and possibly discuss their accommodation requests. Remember that employees are not required to disclose what their issue is related to their mental health. You can only know the prognosis, not the diagnosis, what I can and can't do and for how long. Then they're able to perform the job duties as best as possible or possibly allow for time off. We're going to look at coping with stress. Again, let's get back to connecting with others, identifying what's in your control, maintaining or resuming those healthy habits, creating routine. Routine is comfort, routine is safety. Taking breaks or disconnecting from the news or social media. Sure, it's good to be informed, but wow, we've got these numbers flying across our screen and social media every day, and really it has a negative impact. And then maybe take on a new activity or hobby. Recommended for employers, so you can look at assuring them that everything is being done to protect their health and safety. Hugely important when we need you to return, here's the preventive measures, here's how we are going to work to keep you safe. Maybe start things out gradually. So maybe it's partial weeks at the office and some at home, or maybe it might be staggered so that you have team A in for 3 days a week and team B for 2. Making sure they're aware of what they are able to do, such within the workplace or legislative guidelines, such as leave of absence, paid or unpaid. Maybe they want to use vacation, sick, or personal time. Give them details to any company-provided employee assistance program. Maybe it's local or national counseling services. Check in with them. Consider a weekly progress check-in to see how they're adjusting. Understand each situation is unique. Everybody may adjust differently and at different pace. Show appreciation for them coming back. This can be done in a number of ways. It doesn't have to be financially, just something to make them feel valued. And coming back again to accommodations. They may need a temporary adjustment to their jobs, work environment, scheduling to accommodate their mental health related to coping with COVID-19. This could be extending working from home, flex hours, putting those in customer-facing jobs in a temporary role where maybe they don't interact with the public. And then we're going to get more into mental health accommodations next. So when we talk about the employee might require adjustments to their job, their work environment, or even time off, sometimes they're dealing with severe stress, a crisis, an illness, and they're trying to work at the same time. So it's going to affect their ability to have a clear mindset, not to mention the added stress of trying to complete normal job duties in a not so normal work environment from what they were used to pre-pandemic. It may be providing with relief, such as time to cope with their illness outside of work, time to seek appropriate professional or medical assistance. When they're properly accommodated, it can help them better with their recovery process and streamline their return to work more effectively. Remember, each employee and each situation is unique. So, like a physical condition, accommodations should be considered on a case-by-case basis. They do have the right to ask for certain accommodations, reasonable accommodations, that allow them to continue to do their job. Employers aren't able to ask what their diagnoses are, but you are able to ask to provide for medical documentation. We often refer to this as functional abilities form. I like to put it what they can and cannot do and for how long. Then you look at that and collaboratively make a accommodation plan that still meets the needs of the business while accommodating the restrictions or the limitations the employee may be going through. Also, consider that this is a situation unlike none we've experienced before. So you might want to consider offering some flexibility and additional supports in order to get employees through this time. I often get asked, do I have to? Do we have to, give what the employee is asking? The answer often is maybe. Under Canadian human rights legislation, you have a duty to accommodate. Mental health illness is the same as a physical illness or disability. Depending upon what those needs are, we said we can question what are the limitations, what they can and cannot do. You can ask for the prognosis and then work together to come up with a reasonable accommodation plan. It may be time off. Maybe they're available for short or long-term disability. Even if they're not eligible for that, it doesn't mean that they aren't entitled to having the time off under human rights under an illness leave. See how their pay or benefits or pensions are going to be impacted if they just work. These are things to help them work through. Specifically with mental health, we want to look at, are there other considerations that we could accommodate that maybe don't fall under a functional abilities form? Maybe offering a quiet or private space for someone who happens to be experiencing heightened anxiety or attention or sensory-related issues. Maybe someone wants to be seated near the door. If they have difficulty sitting for periods of time, they need to step out of the meeting room or room. Clearly outline notes of meetings, discussions, or other important communications, because sometimes people just aren't paying attention, whether it's a medical condition or whether it's as a result of what they're going through right now. And if employers have trouble coming up with reasonable accommodations, have the employees suggest ways to make it easier. So as we near the end of the webinar, let's review some of our main takeaways. The workplace can either help our physical, psychological well-being, or it can be the source of stress and mental health issues and/or cause existing issues unrelated to work to worsen. Job-related stressors should be reviewed on an organizational level and find out if the workplace is contributing to these mental health issues. We can use models that are similar to identifying and controlling risks and factors that contribute to physical safety the same way for mental health and psychological safety. The COVID-19 pandemic has brought on a whole new set of mental health challenges for both employers and employees. Those mental health concerns that stem out of COVID-related issues should be treated like any other accommodation. The topics we covered today's webinar, we can be supported through HR Download's other services. If you are already a subscriber, you know that our HR Fundamentals, we have the leading library of HR policies, forms, letters, and job descriptions. With thousands of customizable documents, we're sure to have what you need. Our Fundamentals also includes our in-depth compliance center tool, monthly newsletter, and certainly an ongoing news and legislation updates, along with unlimited support from our client success team. Live HR advice, that's me. While helping your employees better their mental health well-being is a reporting part of your work, the intricacies of it can be challenging. So we have our dedicated team of senior HR advisors available to guide you through these stages and the employee life cycle overall. Our services offer unlimited phone support in English or French, and we tailor it to your unique work environment. Then our HR Complete is discovering our complete solution for your organization under that membership. So with Complete, you have endless resources available to you, including our fundamentals and our live HR advice. You have online training, policies, surveys, and our team and our technology work together to find customized solutions that suit your organization's specific needs. So with that, I will say thank you, and I hope you found something of value out of our today's discussion that can help you move through any uncertain times you may have working in the future. Thank you and have a good afternoon.